flu cases across North Carolina are spiking. We're getting some new numbers the state released just today. It shows nearly 3,000 people tested positive last week. 3 weeks ago, that number was closer to 950. RSV cases in children are also spiking. WRAL's Monica Casey takes us inside Duke Children's Hospital, where the tiniest patients are fighting for every breath.
Every bed in Duke's pediatric ICU is full. These yellow carts mean a child inside this room is struggling with the respiratory virus, requiring partial isolation. 3-month-old Kai Evans' tiny toes are usually kicking.
A very wiggle worm.
But right now, those little legs are wrapped in monitors.
He wasn't moving. He was just sitting there, and I'm like, that's not normal.
His mother, Amanda, says Kai tested positive for RSV. He's high risk, born with 2 holes in his heart.
It's been a roller coaster. If he looks better, he's gotten worse.
Evans is one of many pediatric patients right now fighting a respiratory virus at Duke Children's. Over the last week, Duke Health has 215 lab-confirmed flu tests. Wake Med has recorded more than 1,200, and UNC reports about 400. In that same time, Duke has 248 RSV cases, and Wake Med and UNC are at about 200 each.
We're in a little bit of a crisis, and there's no end in sight.
Kelly Ellington is the clinical operations director for Duke Children's. She tells me they field calls every day from rural hospitals desperate for help.
Our smaller community hospitals they're overwhelmed. They're calling us, begging, we don't have the resources. Can you guys help?
They work to find a place for every patient possible, but sometimes there are no beds available.
I would say we've been at capacity every single day for several weeks.
Assistant Professor Palin Mallory says up-to-date vaccination is vital to combat the spread of these viruses.
We all have the duty to protect those in our population who are most vulnerable to these infections.
Evans wants others to know masking and washing hands can help keep children like Kai out of the ICU and breathing on their own.
Literally, oxygen is just saving his life right now.
Inside Duke's pediatric ICU, Monica Casey, WRAL News.